Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. So now his knee flexion is 110. Remember this, it's 110 knee flexion. Okay? Bend your knee as far as you can. Good. 135 again. It was 110. Good. So let's have some muscle weakness. Can you feel a difference?
Yes.
What the difference?
Pretty good.
He's actually going back and forth. We need to do some strength, but compared to the first time, he was just.
Yeah, you barely.
Look at this. Yeah.
Yeah.
How's that?
That feels real good.
Yeah. How's that?
That feels real good.
0 to 10?
Yeah. No, I'm 0.
0?
Yeah.
That's beautiful. Good.
Yeah, really.
You can have a seat.
It's funny
Go back and forth again. Let's do more. Yeah.
Huh.
Yeah.
That's looked at me, huh?
Yeah, you look good.
Matter of fact, I don't need this.
Well, we'll do it for safety until we work on your balance. Oh,
Yeah.
well, okay, let's show up. Wow, look at this. So he came with the cane.
He's actually bending it.
How
Yeah,
about that?
look at that. His balance look better, you know. Yeah. Good.
Should have
Beautiful.
brought me here before me, huh?
Yeah. How was that?
Feels real good, Doctor.
No cane.
Yeah.
Yeah. This section I will cover 3 common questions that I usually hear from patients. First question is, can I treat myself at home? Second question, can I get similar result to the result I usually get with my patient when I personally treat them, like what you saw in the video? Last question, how can I do that? How can I treat myself at home? So first question, can I treat myself at home? The answer is yes, but you need to have the patient toolkit. You need to have the program on how to use the toolkit to be able to treat yourself at home. You need to have the tools. Second question, can I get similar results? The answer yes, if you follow the entire program. So the program that I recorded, it has everything you need to know and you need to do at home to get similar result to the result you see it with my patient in my channel. Last question, how can I treat myself at home? And I will go into a little depth here on how you can do that at home. First, you need to have ASTR toolkit. This is a patient toolkit that are designed for patient that can be used for the entire body from head to toe. So basically you need one patient toolkit and you actually can treat the entire body, and we have each body part as a program on how to address that body part. So the toolkit has 4 tools. The A3 used to break scar tissue, the A1 used to release fascia and fascia restrictions, A5 I use it to break deep scar tissue and deep fascia restrictions, and lastly the magna heel, we use it to decrease inflammation. Why do you need all the 4 tools? Because each tool used to treat different issue. Don't expect that you treat the scar tissue only that will resolve the problem, because usually with condition like knee pain, knee injury, or post-op for knee, usually there's a scar tissue, there's fascia restriction, there's inflammation. So if you don't have all the tools to treat all of that, it's basically you doing part of the treatment. So full recovery is not expectable in this condition. So the second thing you can do is, if you have moderate to severe inflammation, you can upgrade to MagnaHeal 2. MagnaHeal 2 is 3 inches width. MagnaHeal 1 is 1 inch, and it's wearable. So I use that because it's very strong. That can be used for moderate to severe inflammation. I usually recommend it for patients. You can walk with it. You can exercise with the MagnaHeal 2. So MagnaHeal 2, we use it to decrease inflammation, speed up the healing process, relieve pain. That's for moderate to severe inflammation. The third thing you will need to have is a program, the self-treatment program. So the self-treatment program is about an hour and a half recorded video with a model on how to use each tool, and also on how to relieve your pain at home. There's a section for exercises, what you should do after the treatment. I go over proper posture, body mechanics, ergonomic, behavior modification, the things that you need to avoid to relieve your pain, and also the things you need to avoid to decrease your risk of having this issue in the future. And lastly, going over the anti-inflammatory diet. In the video that I treat patient, and I have it in YouTube channel, I usually show only the treatment part, but I go over all of that with the patient right after finishing those video to make sure they have a long-term result. So that's a program that if you're gonna come and see me, I will go over that program with you, and it's all recorded for you. You can watch it as much as you want when you sign up for those program on my website. So the only difference is you the one gonna be doing the treatment on yourself instead of me doing it on you, but you have the program. So for someone who has moderate to severe inflammation, the two options we have is, first is the MagnaHeal 2. The second option we have the supplement kit. So the supplement kit is actually has 3 supplements that I give it to patients. These are formulas to decrease inflammation. I usually recommend it for those patients that has moderate to severe inflammation. So to summarize, the knee protocol is we need to have the patient toolkit first, need to upgrade to MagnaHeal 2. If you have moderate to severe inflammation, of course you need the step-by-step program for the knee to treat your knee, and if you have moderate to severe inflammation, you can take the inflammation supplement kit. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.